The personalities that matter with Keith Vaz on Talking Points.
Leica Radio.
Welcome back. This is Talking Points with Keith Vaz on Leica Radio. Next is time for Keith's weekend medical checkup with association with Leica Health. This week, Keith will be talking to Dr. Ferha Saeed, who is an East London-based obstetrician and gynecologist and working at Barts Health since 2015. She prides herself on providing compassionate, effective, and efficient care to women and believes in women empowerment in their healthcare decision. She will talk to us about the myths and facts about menopause, the big change. It's estimated that there are around 13 million women who are currently peri or menopausal in the UK, well-being of women. That's equal to 1/3 of the entire UK female population. She joins him this morning from East London.
Good morning, Dr. Saeed.
Good morning, Keith.
What is menopause and how does it affect women?
So menopause refers to the time when a woman is no longer able to naturally bear children, and this usually marked by 1 year after her final menstrual period. And this happens because the woman's estrogen hormone level declines, and it usually occurs between 45 and 55 years of age with an average of 51. And in the years leading to menopause, women may start to notice significant changes which may signal menopausal transition, known as perimenopause. That means time around the menopause. So most women experience menopausal symptoms. There's a wide range. Some women do not at all have any symptoms apart from their menstrual period stopping. On the other hand, some women suffer from severe symptoms which have significant impact on their everyday activity. Many suffer from hot flushes, if you heard, a sensation of sudden feeling, and that sometimes could be very, very difficult to suffer from, and you have difficulty dealing with it.
What's the best approach to managing menopause?
So all women are different and they respond differently to both estrogen deficiency as well as the treatment given for menopause. Now, decision has to be made on an individual basis, taking into account severity of symptoms, medical history, and lifestyle, and more importantly, individual preferences and concerns. So emphasis has to be made on the importance of explaining to women about their effect and consequences of menopause, and that brings the empowerment for that woman to make informed choices about their symptoms and their treatment. So there are a number of treatment our GPs and gynecologists can suggest, which includes hormone replacement therapy and other alternatives, depending upon what symptoms a woman is suffering from. For example, women with psychological symptoms may benefit from cognitive behavioral therapy, a type of talking therapy that can help with low mood and anxiety. I think the treatment is depends upon the symptoms patient is presenting with and their history. Diet and lifestyle advice should be considered first, particularly smoking cessation, weight loss, alcohol reduction, and increasing exercise to help general health and well-being. And then we can go on to different options of treatment according to their symptoms and their background history.
What are the misconceptions about menopause and its treatment?
Even though it impacts all women at some time, Keith, talking about it is still seen as a taboo subject and something people shy away from addressing it. And this actually has provided an opportunity for various misconceptions in our community. The first misconception is that it's an old age thing and probably nothing can be or need to be done. Now, we need to increase awareness that women have to live with menopause for decades, and therefore they will need a well-managed quality life with or without hormones rather than living with it as an aging process. The other common belief is that HRT gives you breast cancer. Now, the absolute risk is very small, probably increased slightly after minimum of 5 years of use of combined HRT. That means only 3 to 4 cases every 1,000 women who are using HRT. So I would like to re-emphasize that the safety of HRT is largely depending upon age. Healthy women younger than 60 should not be concerned about the safety profile of HRT. And even in the older women, the benefit of treating the symptoms and better quality of life has to be balanced with the small increased risk. And our modern HRT can be incredibly helpful. There are clear national guidance already exists to guide GPs and gynecologists who prescribe the right treatment and care. But so often these are not being implemented widely, and outdated myths about HRT are still widespread. Therefore, more and more awareness programs like today's program will help to change the perception about this big change.
Do you think that menopause can affect the performance of women at work? It's not described as an illness. It is a stage in the development of humans. But can there be this kind of effect?
I think you have asked a $1 million question. It's so important that they understand that women may go through the menopause in their 40s, and this will affect a significant number of women in their working life. Now, speaking about menopause in the workplace doesn't come easy to many women. It can feel deeply personal. Therefore, a lot of women will suffer in silence. And that means that despite of experiencing difficulty in managing symptoms, they feel embarrassed and unable to disclose their difficulties to their line managers, feeling that they may be stigmatized for being menopausal. Now, due to symptoms of mood changes, poor sleep, and lack of concentration, the work performance may be affected until we manage the menopause. Now, it has been found that problematic hot flushes symptoms at work have been linked with women's intention to leave their job. It is that serious. And therefore, employers in UK are encouraged to offer awareness and support. And one way of doing this is to provide some kind of internal organizational guidance. And some employers have taken this on board with education and support, but there is still work needs to be done. There are a number of ways to approach raising awareness of menopause in the workplace and actually in the wider community by organizing training and awareness events. We really need to empower women to make informed choices and improve their quality of life, which happens after menopause.
Finally, what can men do to help women with menopause? Sometimes, of course, women don't want to tell men that they are going through this change. But is there anything that we can do to help?
I think it's a part of the whole cultural change which we aim for, that we should be able to speak up about menopause openly with our family members, friends, irrespective of their gender. And living in this society, if male members can understand this change and they're happy to embrace that change and happy to help their female family members going through menopause, their friends going through menopause, and more importantly, their colleagues who are going through menopause, I think that will bring a big cultural change which will help these women to speak up openly about their menopause.
Dr. Ferha Saeed, it has been a pleasure talking to you. Thank you for giving us this very important information, and please do carry on with the excellent work that you are doing in this area and in general medicine. Thank you for joining us on Leica Radio this morning.
Thank you very much, Keith, for having me on the program today, and best wishes to the listeners of Leica Radio.